COVID-19 pandemic highlighted existing socioeconomic conditions affecting health and the importance of family and community in infection prevention. It underscores that working together can lead to maximum health benefits for more people. The City of Worcester Division of Public Health and its health partners are working tirelessly to reduce health inequities. Funded by a CDC Racial and Ethnic Approaches to Community Health grant, the Division of Public Health is strategically targeting communities with historic health disadvantages to provide vaccines and community education. As part of this effort, the Division of Public Health identified churches as an agent of change for overcoming health disparities.
As a church, we take care of the spiritual side, but about the physical side, your body now, you hear especially doctors, health workers, omni and working hand in hand, and yet to me, ama body no yet me taking care of the body, both physical and the spiritual.
The church's role in this type of empowerment of its membership is actually necessary, in the sense that the church is a social organization. It may be religious, we pray according to our belief systems and faith and whatever, but it's also a social organism, and what is the knowledge of one ought to be shared.
For this is the reason why the church initiative was created. We discovered early on that word of mouth is really strong within the communities of color, and actually in all communities. So the channels of how socially the community communicates was becoming really important. So bringing information and education, especially about COVID-19, into a setting where people feel safe and happy, such as a church, in a community setting, was really important, and especially to influence change. Not just to get vaccinated, but to understand the reason to do it for their health and for their families, and just to protect their own community as well. So the church initiative was created, and it's been a really powerful experience to be kind of welcomed by the community and create a trust between public health and education, and with church leaders and churchgoers. So we've tailored the church initiative to impact the actual health from that community. So it could be about hypertension, it could be about nutrition, diabetes. We just really need to know, and we have the passion and we have the staff to do it. So the church initiative maybe started with COVID, but it can go beyond that.
For the Good Shepherd Ghana Methodist Church, congregants and officials agreed that hypertension was their most pressing concern.
If we say, Ubenya Huadia, if you were Driani, Ubenya Yareswa, if you were Driani, into your per se, Yenya Huadin, near to me, Ediat Nana Fiyache, because I really say, Ababe Bray, first and Nanka, Uma, as any bay 90 years, 80 years, Yare.
So just hearing said we have a forum about hypertension, it made me so happy, because especially in America, Ghanaian food combined with American lifestyle is an equation for hypertension, is an equation for all these chronic diseases that we have. And I will share COVID in Swa. Lots of people that were affected by COVID, they had these little comorbidities like hypertension, like diabetes, and all these chronic diseases are, yes, na yakupon de amai say yendru, am I yendru. So for the church to take the proactive step to attack these health conditions at the very roots, it made me very happy, and I'm actually proud to be a member of Good Shepherd Ghana Methodist Church.
So I would say that for my church to hold a program like this or an event like this, I'll say it's a very great privilege to me and to other mothers to have experience or to have the knowledge of hypertension, because honestly, I must tell you this, I have no idea what hypertension is.
I'm said COVID. Hypertension, diabetes, but Nina, ye did ye and a deba, and unti, many I just set our program in Basso.
It's another man, a dream, if your papa a dream was said. So penny Thomas Ofori or my quine said, you bet to me nothing, you're draining in leaders. I say, bet to me, I yes, said you may.
Following an initial discussion about COVID-19 and health, they decided to bring awareness and promote good nutrition and healthy lifestyle as part of their Mother's Day celebration.
Happy Mother's Day to all women. We're using this year's Mother's Day to create the awareness of hypertension, the silent killer. Yakase hypertension a medical term for high blood pressure.
A big benefit that we saw that day from organizing the health event based on their specific health needs is that it generated high levels of interest and participation. So that's what we saw at Good Shepherd.
Calm your mind, calm your body. This is it. It's okay. So you're breathing.
All the members were very involved in everything we had going on, including blood pressure screenings, the food demonstrations, the physical exercises, and the vaccinations afterward. So we had lots of questions, lots of interest, and several individuals who were specifically interested in COVID-19 vaccinations.
True and ra, dear yea, any kakra makawa hasen. Wokofia, wonkai bibia cry. Kai say hypertension, ujana wa a bit mukum. But a preventable, and I say manageable. Na fruits, any vegetables, a drew. Pursue how it works for you as an individual. Seek help. Because obia ye unique. Where ye beka a general level. Then water is medicine. Rest is medicine. Exercise is medicine. Cleanliness is medicine. Then get vaccinated against vaccine preventable diseases. Then good neighborliness against diseases and mental stress.
Many people were involved to ensure a successful program. Rose, a talented media technician and also a member of the church, recorded these interviews, and many church members showed their skills and talents by cooking delicious food for participants. Dr. Benista, a member of the church, provided a medical explanation of hypertension.
Blood pressure and measure the pressure blood applied to the inner walls of arteries are blood vessels. Because blood vessels intini. The United States Preventive Service Task Force will recommend they say every 3 to 5 years, obia with the 18 to 40 years, you be screening. With the above 40, I see a day screening for blood pressure every year. As mekano, blood pressure or a silent killer usually uncauses symptoms but it lead to serious medical problems. A benin say a cause heart attack, unya stroke, high blood pressure so idea bibia a destroy your kidneys ability to the friend chronic kidney disease. Now for the eventually could lead to something your friend saying end stage kidney disease. Now for the ASN so we hear dialysis. Near ye me be a bit me and my blood pressure above form and then your friend lifestyle changes.
So we're really excited that the event's happening and that everybody is here. We're really looking to spend a lot more time being in the community, working with all of you, really getting to know you and what you need and where the gaps are so that we can better help serve you in the community and the city. So thank you so much for having me and my voice in tow this morning. And thank you to Irene for putting this all together.
No one can deny the mistrust communities have for public agencies, for that matter, public health. No one can also deny that communities are faced with many health challenges they wish to resolve. However, our work with Good Shepherd Ghana Methodist Church shows that with the right working approach to building relationship, creating the space for dialogue and listening, and providing communities with the required resources, we can establish the needed trust to work together to resolving the community health challenges. Dear churches, you have the space, you have the community. Let's work together to support families tackle health challenges. With our partnership, we can support directly many of the Worcester population to improve in their health and vaccine knowledge, and also to create more health ambassadors within the community. Thank you.
If the church embraces events like this, it helps to inform its members.
Trust can be rebuilt. The experience, interest, and feedback from the church members show how important and necessary this health event was to them. This level of reach and engagement was only possible because Reverend Dr. Ofori, Sofomame, Mary, and the church leaders recognized and utilized their space as an additional resource to ensure health for all. Health is the work of all. Proactive health teams, community partners, and active participating communities and individuals produce good relations and improved health for all.
It is a good and a wonderful program. We are all looking forward to participate and learn what to do so that it can prevent hypertension, a lot of diseases. Thank you, Good Shepherd, for promoting such a wonderful program. And I hope more and other things will follow up. Thank you, Good Shepherd.
The temple of God. It is a shiny year. Meaning, say, I'm the edge of it. You do biase. You can't die yourself for penniase. So I had this will be quiet and then public health phone so you don't them.
Yaminshira organizers now organizing now we thank God, say God will continue to bless them so that anytime they want to organize such programs, if they let us know about it, we will just join hands with them.
Happy and you know, clap your hands. Happy and you know, clap your hands. If you're happy and you know, and you really want to show, if you're happy and you know, clap your hands.
Contact us.